Good morning, my name is Claudine Aguirre from M2A section. So today I will be doing the bed making using the unoccupied technique. So first I will assemble my equipment and then I will arrange it on the bedside chair to follow the proper organization. And then after that, I will now perform my hand hygiene to prevent the spread of microorganisms and wear my PPE to follow the transmission precaution. And then after that, I will now adjust the bed at the working height, usually at the elbow height. This is for me to prevent from having any strain while doing the work properly. And then after that, I will also disconnect all the devices and other tubes to prevent the damaging the devices. And then after that, I will now put on my gloves to prevent the spread of the microorganisms. Okay, so now I will now loosen all the linens as I move to the bed from the head to the bottom and to the side to prevent from clogging and tearing the linens. And then I will also fold the reusable linens and hand it over the clean chair so to save time and energy. And then after that, I will now fold and snuggle the soiled linens and place it on the laundry basket to prevent the spread of contamination on another patient. And then after that, I will now clean the mattress and dry it according to the facility policy before adding the new bed linens. And then, after that, I will now remove my gloves and to prevent the spread of any contamination and throw it to the proper bin. And then after that, I will now place the bottom sheet with its center fold to the center of the bed and open the center and fan fold to the center. This is to ensure the sufficient this is to ensure the sufficient tuck in under the mattress for both sides of the bed. And then, after that, will now place the draw sheet with its center fold to the center of the bed, and again open the sheet and fan fold to the center, placing it under the patient's midsection. This is to ensure to save time and more energy when you go around and move to the other side of the bed. And then, if the protective pad is used, so I will just put it in the over the draw sheet and open to the center fold. And then after that, I will now pull over the bottom sheet over the corners at the head and the foot of the mattress. This is to ensure that to avoid any wrinkles and to make the patient go over the bed and move around properly. And then, as well as I will also have to tuck the draw sheet under the mattress of the bed to secure it properly. And then after that, I will just move to the other side of the bed and do the same procedure, just like what I did on the other side. Again, this is to prevent the patient from having a discomfort and move to the bed comfortably, and to avoid any proper wrinkle. So just securing the under the mattress. And as well as the head of the mattress. And again, don't forget to tuck in the protective pad and the draw sheet as well securely to the other opposite side. So just assume that this is a short protective pad since I don't have a real protective pad on my end. And then, once you are done now with the bottom sheet, I will now place the top sheet with its center fold to the center of the bed with the hem even with the head of the mattress. This is to ensure that the patient can go easily over the bed when he or she lay down. And as well as the purpose of our draw sheet and our protective pad is so that if the patient saw the linens, we can easily change the draw sheet and the protective pad without the top linen and the bottom linen on the bed. And this can aid the moving the patient in the bed. Now, proceeding to the top sheet. I will just follow the same procedure, just like what I did by placing, the upper edges about 6 inches below the top of the sheet. And then, after that, I will now tuck in. I will just tuck in the top of the sheet under the mattress, under the foot of the mattress. And then, what you will need is I will fold the upper edges, the upper 6 inches of the top of the sheet below the mattress. And then just move to the other side and just repeat the procedure. Make sure that you go over and see if they are all well properly tucked over or under the mattress. And then after that, I will now get the pillowcase and remove the pillowcase and open another one just like what I did on the same procedure on the other linen, and put it on the proper laundry basket. To prevent any contamination, once again, for the patient who will use the pillowcase. This is so that I will also prevent from having a stream by resting it on the bed, and since opening the linen by shaking it can cause the organism to easily spread on the ear. Okay, after that I will now fan fold or pie fold the top of the linen to make it again easier for the patient to go over the bed and secure it properly. Then on the other side as well, don't forget about it. And then, now that I'm done, I will now again connect all the call device so that the patient can easily go over if he or she needs an assistance. Pretend that I now connect all the and secure all the devices. So after that, I will now dispose all my soiled linens to the proper laundry basket and have it to the washing machine. And then, after that, I will now perform again a hand hygiene to prevent the spread of any contamination and remove my PPE to follow a proper precaution. Hello, my name is Claudine De Aguirre from M2A section. So today I will be doing the bed making using the Unoccupied technique. So first I will be doing is to check the chart for the limitation of my patient's physical activity to promote cooperation as well as to determine the level of his activity. Okay, assume that I am now done with the chart. I will now assemble all the equipment and arrange it on the bedside chair for the proper organization. Now I will now perform my hand hygiene to prevent the spread of the microorganism as well as my PPE for a proper precaution. Now I will now identify my client. So hello sir, my name is Claudine De Aguirre from your student nurse. Can I please know your name?
I'm Jana Dagbuya.
How about your age?
I'm 19 years old.
Your birthday?
June 1, 2007.
For verification sir, can I please check your identification band? Okay, so for today, sir, I will be doing the bed making using the Unoccupied technique. So you will just lay down there while I change all your bed linens. Is that okay?
Yes, ma'am.
Okay, so now I will now close the curtains and the door to provide certain privacy. And then, after I do that, I will now adjust the bed to a comfortable working height, usually at the elbow height to prevent myself from having any muscle strain. Then I will now lower the nearest side rail while keeping the opposite side rail up and put the bed on a flat position so I can make and I can make the linen properly cut. Then after that, I will now put on my gloves to prevent the spread of the microorganisms. And then after that, I will now check for the bed linen for my patient's personal items if there is any. Okay, there is not. So I will now disconnect all the hall devices first to prevent from damaging the devices. And then after that, I will now place this top blanket over my patient to provide him a privacy and warmth while doing the procedure. Okay, so can you please hold the top of this blanket? And then after that, I will just go underneath and remove the top linen. While keeping still the privacy and warmth of the patient. Okay, and then I will now keep this on a laundry basket or any laundry hamper to prevent the spread of the microorganism and contamination to the another patient. Then, if necessary or if possible with the another assistance of the person, I will grasp the mattress of the mattress securely and shift it up to the head of the bed so that so it can allow to have a footroom for the patient. And then after that, I will now assist my patient. So can you please turn to the other side of the bed? Okay. Then reposition the pillow. This is to allow the bed to be made on the vacant side. And then after that, I will now loosen all the linen from the head to the foot and the side. This is to prevent from tugging and tearing on the bed linens. And then after that, I will fold by it so that it can to make it closer to the patient, so it can make it easier for the removal of the linens later on. after that, I will now put the bottom sheet with its center fold to the center of the bed and open it and fold to the center. And then after that, just make sure to pull the bottom sheet over the corner at the head and the foot of the mattress and tuck it under the mattress. And then after that, don't forget to place as well the draw sheet with its center fold to the center of the bed and open it and fan fold to the center as well. And then I will also, and then after that, I will also place this protective pad over the draw sheet and then open it to the center fold, which is it should be in the in the midsection of my patient. So just pretend that this is a protective pad. Okay, so after that, I will now raise the side rail. Okay, and now I will assist the patient to turn now to the opposite side here, which should be facing in front of me. Okay, sir, can you please turn toward this position? Sir, your foot. And I will reposition the pillow as well again. And then, after that, I will now loosen all the soiled linens, which is the rear, and put it on the on the laundry basket. Just to make sure this is to prevent us for any contamination and spread of microorganism to another patient. Okay. After that, I will move again to the opposite side. So I will now ease the linen and pull over the corner at the head and the foot of the mattress. So this should be much easier. And don't forget also to tuck down the opposite side as well. Let me just fix my gloves. Okay, so now, after that, don't forget to also tuck the jaw sheet and pull it over the under the mattress, as well as the protective pad. And then, after that, I will now assist my patient to turn on the center and reposition the pillow. Then, after that, I will now first remove the pillow once again, and as well as the pillowcase, and open to a new pillowcase. But make sure to put this on the logic hamper once again to prevent the spread of the contamination. So I will just do the same procedure, just like what I did to the other linen. This is this is to make it easier for me to do the pillowcase without having any strain muscle, as this is also much better than shaking it, which can cause spread the organism into the air. Then I will now place pillow once again. Okay. Do you still feel comfortable, sir?
Yes, ma'am.
Okay, so after that, I will now apply the linen, or the top linen, or any sheet or other blanket. And then I will just fold it. Can you please hold the top of the linen? And then I will just secure then I will secure the top of the linen under the foot of the mattress and meter the corners. This is to make it easier for the patient to move around the bed comfortably. Before we do that, before we proceed to metering the corners. So let's just first remove the bath blankets that we did for his security, since he has now the top linen or the top locket, and put it on the laundry once again. And then now we have now to secure everything, including metering the corners. And just loosen the the foot of the mattress so that our patient can move around much easier. Then I will fan fold the top of the linen. Okay, sir, now do you feel comfortable?
Yes, ma'am.
Okay, so now that we are done, so I will now I will now secure once again the connecting devices so that it will be easier for the patient to ask for assistance if he or she needs it. And then after that, I will now remove my gloves and throw it to the proper trash bin. And then after that, I will now do my hand hygiene and make sure that I will dispose all the soiled linens to their proper disposal. And that's it.